Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hello, and welcome back to the Sit and Stay podcast brought to you by RipsyTech. As always, you are joined by RipsyTech product manager Parker Anderson and RipsyTech founder and CEO Tom Tarshis. Hey, Tom.
Hey, Parker. Good to see you.
Always good to see you as well. We have a very good episode today where we are going to be discussing teaching, supervision, mentorship, just the whole everything pertaining to your mental health provider career. Like how can one stay connected to being like, I guess kind of like an educator or just, somebody who's in this mentorship type of position. How can you maintain some semblance of that throughout your career? So take it away, I guess. What do you think?
Yeah, and I think, right, normally the way the podcasts work is, at the beginning of the week, Parker, you'll throw out hey, ideas for the podcast, and then sort of whatever I'm in the process of doing usually gives me an idea. And I think I was getting ready to head down to Stanford University, which never, go Bears. As you'll see from the shirt I'm wearing today, as I say Stanford University. Oh. But, good people at Stanford. And so hey, let's talk about sort of mentorship, supervision. I think we could do another episode on what it's like to be more formally doing teaching or adjunct faculty type things. And we'll keep this one just around mentorship and supervision, but we haven't talked about that, and it's something that many people enjoy doing. And in this field, where no matter what type of clinician you are, you will have progressed through the educational hierarchy to actually be fully graduated and licensed. So you have had many different mentors as you've done that. Hopefully at least a couple of them have been good. And often having just one that's been good can be inspirational to helping people want to do the same. So, yeah.
So, okay, you mentioned in there that we're not going to focus on the educational pieces necessarily, but more so like supervision and mentorship. So I guess for people who are in that position, what are the most meaningful ways that they could go about getting engaged with that sort of thing?
Yeah. And there's different, depending on where you're at in your training, there are opportunities for kind of mentorship beginning very early. So even, for example, when you are just beginning out in graduate school, whether you're in a social work or LPCC or other sort of master's level degree program, or a PhD or PsyD program, or a medicine program if you're starting medical school, there are going to be undergraduate college students and high school students who are interested in psychology and therapy and mental health. And over the many years, I almost like it the best when you get the emails from a high school student or even middle school students who are passionate about mental health and want to see if they can connect with someone or maybe do a project together. And this is a perfect opportunity for someone early in their professional training to have someone to mentor.
Well, how do I go about finding a high school student to mentor?
Yeah, well, and so that's a good question. And we do know, right, psychology is still, I believe, the number 2 major in all of universities.
That was my
business. Major. And so there's a lot of undergrad students as well. I think, it is possible that one of these opportunities may fall into your lap, like,
Right.
through a peer connection, or when you're starting off in one of your classes, maybe a professor mentions, hey, we have a relationship with this high school where we like to pair students interested in psychology with someone who's starting their graduate program. I think those are less likely to happen unless you're in with someone who has an established relationship. So however, almost every high school these days has a mental health club that has students in it. And similarly, most colleges have a sort of mental health interest or psychology interest club. So you can throw your name out there as someone who is interested and willing to mentor someone along this field path. And almost certainly you can find someone to mentor.
Now, are there any kind of like professional organizations or like affiliations type of things that like memberships even that you could join? Like, I don't know, like a special interest group or something like that. Like any type of group that is, offers like that kind of mentorship. Like, do those exist in the mental health provider space?
Well, so there are these sort of extra training or certificate programs for like specific psychotherapies that you can do sometimes at any level of training that you're in, that will often you'll be paired with someone who has a certification in that field. So if you are certified, say, in mentalization based therapy, there are professional opportunities to be paired with someone who's also learning that. There are these sort of other, an Asian American mental health group. There are these other sort of specific targeted mental health agencies that is a good way to join at any level. And there would certainly be other people at different stages interested in the same thing. So that could be another venue.
Okay, that makes a lot of sense. What about okay, I mean that in and of itself sounds like a really great opportunity for somebody who's a bit more established in their career. But what about somebody who's maybe an early career provider who I don't know, maybe they used to be a teaching assistant in college and they just loved it, and now they're off and they're on their own, and they miss having that relationship with a student or a mentee of some kind. What, I guess, how would somebody in that position go about that?
Yeah. So, and this is now, yeah. So we were sort of talking about opportunities to do some mentorship before you're fully licensed. So now we're getting to
right.
Once your early career have achieved that license, and this varies state by state and depending on which professional path you're going down. For example, I believe to be a formal supervisor for other master's level providers in the state of California, you need to be at least 2 years licensed and then complete, I think it's just like a 1-day or course on how to be a supervisor, and then you have your supervisor certificate and you can begin formally supervising other master's level providers. And there's different, we can talk about that piece a little bit more. Similarly, if you're a new psychologist, there is also, I think, in California, a 2-year waiting period. I don't think there's like another formal exam, but in order for someone, and this we're more talking about people who need to have the mentorship hours, that you need to make sure that you're getting supervision from someone who is legally allowed to provide that. And then, if you're a physician, a newly graduated physician or a psychiatrist, there's in this career path, you're sort of always mentoring the subgroup behind you. So when you're a intern, you're supervising medical students. When you're a resident, interns, a fellow. So there is this sort of built-in hierarchy in medicine. Once you're licensed, though, or, I should say, once you're done with your training, though, and become board certified, then you're able to more formally take on supervision and mentorship, not only of other people who are working towards being a physician, but you can actually supervise psychology. If you're a board certified psychiatrist, you can supervise 500 of the 3,000 hours for psychologists in California. And you could, and same thing for master's level providers. You're allowed to be the supervisor for a good chunk of hours for any person pursuing their mental health training. And I think it's been very enjoyable to like provide those hours for people in social work programs or in psychology programs, and it's usually a win-win situation. So you don't always need to be confined to the field that you're in to give supervision. We even had, at Stanford, even we had social workers who did some of the teaching or were sometimes the therapy supervisors for physicians as well.
Yeah.
So it can go,
That's pretty cool.
It can definitely go both ways.
Well, so what's the difference? You're talking about supervision and mentorship. Like, what is the key difference? Is it that like supervision is specifically contributing to some hours for licensure, and mentorship is just kind of like a general thing that you can do for anybody?
Yeah, that's correct, and that's how I'm using these terms. So, formal supervision is something that every mental health career path needs to receive during their training, and
Right.
in very general terms, it's you're seeing some patients as a not fully licensed or not fully board eligible
Right.
clinician, and so you need to sit down with someone who's licensed to talk about the cases and receive that formal supervision. And they're often being listed with their license on your medical records, that they are the ones who are providing this supervision.
Okay, so what about... Okay, you can provide supervision, you can provide mentorship. Like, I guess, why would you do one versus the other at kind of like any given time in different stages of your career? Because, like, I can imagine maybe you hit a point where you're like, oh, yeah, I would really like to supervise people, and you do that, but then maybe you say, I don't want to be responsible for the explicit training, or maybe I want to talk to more people who are interested in receiving some kind of mentorship, like maybe working with more like late stage career. I guess, like, is that the distinction, that like mentorship is more like something that you get and receive kind of later in your career as opposed to supervision? I mean, I guess you can give at really any stage of your career, but like, is that making sense?
Yeah, I mean, I think there's a couple of distinctions here, like, to answer your question. I mean, clinical supervision really means someone's coming and talking about their cases, and you're providing guidance on what to do with those patients.
Right.
It is something that you're committing to this work for an extended period of time usually, and as you mentioned, it is a real commitment, something that needs to be scheduled and taken seriously. And depending on what you're doing with your job, your practice, what's happening in your life, it may not always be feasible to make that time commitment. I think what mentorship, it might be talking about patients, but often mentorship kind of implies, hey, it's an open, it's an open book. Whatever your mentee is coming in and wants to ask you about, that's on the table. So, for example, I might do some clinical supervision with, a child psychiatrist in training, and we're talking specifically about, hey, we're doing a treatment for obsessive compulsive disorder. But I also have fellows who I meet with in a pure mentor role where, hey, they're coming to ask about career choices. They're coming to ask about, hey, what do you think of AI in this? They're coming to ask about research ideas, but really it can cross, you're just there to answer whatever's on the mind of your mentee. And I think, as you sort of get more time in the field, or so often people get pointed to me in the community who have an interest in technology or business because of my, people know that have experience, good and bad, in both of these areas. And so if someone comes and says, oh, I'm really interested in starting a clinic, or I want to develop this new program, a lot of people in academic centers don't really have that skill set. And so that's a way for people to wind up getting in touch with me. And
okay, that makes a lot of sense. But my lingering question is just like, are you getting paid to do any of this?
Parker, it's not about money.
It's not about money. It's not about money. It's not about getting paid, and it's, for the betterment of other people. But like, I guess, like, serious question though, like, is that, do people pay for supervision or mentorship, or is it kind of like public service, so to speak?
So there's a lot of variations here. Definitely some clinical supervisors are paid an hourly rate by whatever institution the students are from to deliver the clinical supervision.
Okay.
So people who are kind of, have a preliminary license but need to accumulate hours, there are relationships where you pay your mentor to provide that. And or like if you're seeing patients under someone else's private practice, they're keeping revenue that you're generating that you're sort of responsible and lending your name and providing the supervision on.
Right. Okay.
There are then there are places that maybe you're not being directly paid. So for example, I'm adjunct faculty at Stanford, and I'm volunteer clinical faculty at UC San Francisco. So I need to give Stanford 100 hours a year of my time in various activities. So it's sort of 2 hours a week I need to provide. And I do not get paid for that. But what I do get is to say I'm, adjunct faculty at Stanford University, which, as we're working on marketing a lot these days, there is actually a value to being able to say that.
Yeah.
I'm not I'm not someone who actually puts it on a business card or puts the Stanford logo or does things like that. But you are entitled to do that and that's how Stanford pays you for your 100 hours
right.
a year you're giving them. That being said, most people are not doing it just to have that Stanford affiliation, because we do it because it's an honor to work with.
Right. I mean, nor are you doing it for that reason, right? You're doing it because it is an honor. That being said, if you have, I don't know, like an employee that you're on a podcast with that's in charge of all the marketing for your EHR company, he might be interested in leveraging that in more marketing materials, but I digress.
Yeah,
all right.
I mean, fair enough. I mean, I think there is this issue, and I'm especially not great at this, where so you need to give your 100 hours a week. That's great. What really tends to happen though is if you're kind and available, you will get more and more requests for your time and availability. And so you do need to watch. I've gotten a little better at this over the years. You do need to watch how many people you say yes to and be aware of your commitments and know the value you take from it, but not get yourself in a situation where you've overcommitted
right
to being a mentor for people.
Yeah, I wanted to ask about that. Like, how do you balance not taking on too much, but then at the same time, like, I imagine for some people it's like, okay, I need to not take on too much, and then for other people it's like, maybe I'm working in private practice and I feel somewhat disconnected from the provider community, and they are, feel a bit more isolated. Are there like those? That certainly seems like it would be a benefit to that person. I guess are there other professional or even personal benefits of being involved with mentorship and supervision?
Yeah, well, and that is very true, Parker, right? So for someone in a solo private practice, that can be very isolating. Having a couple of mentees or, people you're supervising or working with, it's nice to, it's not a direct colleague relationship, but well, maybe it is, but it is getting you some contact with another professional and not just seeing the patients all the time. I think one of the nicest things about always taking our youthful, bright mental health professionals, it's a good way for you to stay up on current treatments, to like be on your toes. It forces you to stay current with these young whippersnappers bringing all this AI generated questions to. So a lot of people who otherwise maybe wouldn't be as good about keeping up on new treatments, this can force you to do that, and people do that intentionally. There are actually full clinics where a licensed provider maybe has 10 people that they're supervising, and then that's generating all the revenue for the clinic, and they're spending their time just providing supervision for a large number of trainees. And there are a lot of clinics that operate that way.
And you're saying generating revenue for the clinic in the sense that the money is coming from the institutions that these providers trained at, or?
No, for this model, it's so as we've talked, for cash practices. So insurances, other than Medicaid, in general, won't pay for non-fully licensed clinicians. Right. However, once you have an associate license or a psychological assistant license, you can have a cash practice and charge whatever you want.
Right.
So
flat fee.
A licensed provider, maybe the rate for the licensed provider is $250 an hour, but they have 10 associates that they charge $100 an hour for, and then they pay their associates $50, and they keep $50 for providing the supervision. And it can be a good business model. I think given how,
I imagine that's a good way to actually also offer like cheaper services for people who maybe can't take insurance, or don't have insurance, or just want to be seen at that clinic and aren't in network or something.
That's very true. And I think so we have a master's level student that we just charge $25 per session to see. So that's like a great option for people. I think the one thing to be careful of is, in general, a lot of people don't understand the different levels of licensure and other items. And so you want to make sure that you're transparent around if someone is not fully licensed or where they're at with their training. And I'll say sometimes that's not super clear, or is maybe not as out in the open as it should be.
Yeah. I've certainly heard stories of people being like, oh, I was trying to see a provider and they put me with an intern. And for some people, it's like they don't care. And other people are like, no, I need to have the licensed person. So yeah, I can see that.
Yeah. And the one thing we do know about therapy treatment, especially, is it doesn't really matter your degree or how long you've been doing it. It tends to be about a rapport skill set that sometimes is present right away. So like there's no reason not to be open and honest about what level you're at or where you're at with training or who's working in your clinic. So there can be some good psychoeducation around that.
Absolutely. Okay. So you mentioned earlier you need to be careful about not taking on too much. I guess, what's a realistic way of fitting this into your schedule?
Yeah. And, it ties in, Parker, if we're looking at people sort of in private practice or a small group clinic setting, every, if you're in one of these lucky situations where maybe you're getting paid equivalent to what you would earn providing clinical services for that hour, it becomes sort of a no-brainer.
Yeah.
But if you need to do 3 hours prep for that 1 hour, then there is an opportunity cost there.
Right.
But in general, if you're doing this sort of to get, adjunct faculty status, or you just enjoy the mentor-mentee relationship, or have, signed up to donate 2 hours a week, it all goes, Parker, it all goes back to the budget for your clinic. Where's your revenue generation from? How many hours do you need to see patients? And so
Right.
if for your paycheck and to pay your bills, you need, 28 hours of patient care a week, but you've got 30 hours scheduled, then you can give those 2 hours volunteering or providing mentorship or just using it as non-revenue hours. So it all goes back to just being diligent about how many spare hours do you have to give to a task like this.
Okay. That makes a lot of sense. I have no further questions other than, do you have anything else you want to touch on this topic before we move on?
Yeah, no, I think it's, there are other ways to sort of get some mentorship, and there are professional practice groups that meet. There's a group in one of our buildings of various different mental health professionals that gets together to do a journal club sort of once in a month. So there are other sort of group ways that you can provide some of this mentorship also, or be involved with people at different levels of training and variety of groups. And I'm all for, collaborative models of mental health care and getting to know, all mental health providers. And I think taking that challenge of mentoring someone in a different field or different degree program that you're in is super helpful and rewarding. So go for it. Find that hour. I do think even if you're giving up this hour, we talked about the intangible benefits of being like adjunct faculty. If you mentor someone in the community who's going to be another clinician and you do a good job, there is that value of referrals and getting to know other people in the community, and then building a network up through that also has marketing and potential revenue value.
Networking always has its benefits, I would say. Okay. We haven't done no, I shouldn't say that. Because I'm really, we were recording this the week after we released the ACAP episode, but this episode is actually coming out much later than that. So I was going to say we haven't done a mental health business moment in a while, but actually, to the listener, they don't know that. So, well, you and I have not done a mental health business moment in a while. So what's new? What's happening?
Yeah, and I think I hate to pull out the like recurrent ones, but I'm just gonna pull it out. But because this time without saying the specific insurance company, I'm going to talk about two specific instances with this insurance company this week. One was working. They both have to do with single case agreements, as we're out of network with this insurance provider. For one of them, I actually recorded myself during the process, which took an hour and 20 minutes.
Recorded yourself doing what exactly?
I recorded myself being on hold and talking to people.
Okay.
And actually, Parker, I wanted to sort of like show you the, get the transcript from the video and see if there's like a podcast episode in here. And you'll get to hear Tom quite irate at one point.
Wow.
But during this process, like I got pretty far and they're like, okay, we're going to transfer you. And then it just went all the way back to the beginning.
Oh gosh. I've been there.
And then when I got to the point, the next time you'll hear me, do not just transfer me. You are going to give me a warm handoff. And they did. And then, Parker, 4 levels down when I get to the section I was trying to reach.
Yep.
It was very nice and apologetic. And the person actually said, man, I wish they'd just give the direct number. I'm like, yeah. Hey, how about that? Me too.
Yeah.
Maybe not that in tone, but
I wonder how many phone calls that person actually gets. Very interesting.
I don't know. We should. I'll share that transcript and video with you, and maybe
I'll take a look at it.
Something in there. Being careful to only record my half of the.
Oh, well done.
You're not allowed to record others, so there's a camera on me, and you can hear me. The second one, which was worse, but with the same insurance company, and I think it's, some insurance plans are better than others, and this other one I was calling about, that they didn't have as good of a plan. So instead of actually having a team in the United States that deals with single case agreement requests, it is a call center somewhere overseas. And it was impossible to convey what I was trying to call about and make happen, to the point where I'm saying, I need to get we're trying to get a single case agreement to see this severe case that can't find a provider. And the only answer I kept getting back, again, not picking on the people who are doing this, because they're talking from a script, was, okay, well, to get a single case agreement, you need to have the current provider call us and say they need a single case agreement with someone else. It's like, hey, there is no current provider.
Okay.
How am I going to get a current provider? Like, they're coming to me because they can't get a current provider. How am I possibly going to get a current provider to initiate? And it just kept going back to the same.
Oh, gosh, yeah.
And I think I didn't record myself on that one, but ultimately I just hung up.
Wow.
Definitely in the, maybe not an hour 10, but definitely in the over 30 minutes.
Definitely in the waste of time range, for sure.
Trying to help these families.
Yeah.
I'm stubborn, so it is this thing that is always the reminder of, the people, mental health providers, who will do some of these battles on behalf of their patients. Like, gold stars to you and awesome, but that is asking a lot for someone in a private practice or on your own or in other situations to, like, waste to, where are you going to get this money to do that? And so we talk about that often. If you can get that good contract and things go smoothly, it can be good to take insurance. But if you're dealing with madness, it is hard to pull off.
Mm-hmm. All right. Well, this has been a great episode. This was fun. We hadn't recorded in a couple of weeks. Well, we recorded at ACAP a couple of weeks ago, but we hadn't done, an at-home recording, so to speak, in a few weeks. So yeah, this was nice. I'll go ahead.
Parker, so before you wrap up, just to
please.
like disclose to our audience, another intangible benefit of mentoring is it's fair to say I mentored you on some research many years ago.
Oh, you know what? That is true. Okay, wait.
And that was
how deep into this rabbit hole are you trying to go?
Well, just to say, like, I wasn't being paid for that, but all things being said, it both, got you interested in certain things and then kept our relationship intact. And now I've earned this amazing employee and friend and product manager. So that was definitely paid off for me.
It certainly was an investment into my future, because that your willingness to mentor me on those research projects at that time certainly kind of like split the timeline for me into just a completely different path that I went down, which frankly, if I hadn't gone down that path, I never would have met my wife, and I wouldn't be, living in the house that you see me in right now. So kudos to you, Dr. Darshis.
So why isn't your son's middle name Tom?
Oh, okay.
The next one.
We'll get there. Maybe the next one. All right. This has been a great episode. Thank you for tuning in to this week's episode of the Sit and Stay podcast. If you enjoyed the episode, we would love a rating or review wherever you are listening. And if you want to get in touch, shoot us an email at sitandstay@RipsyTech.com. And I will see you later, Tom.
Take care, Parker.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.